What specific tests diagnose your type of dry eye? Imagine trying to figure out why your eyes feel dry and uncomfortable. Doctors use a variety of tests to understand what kind of dry eye you have. These tests look at how much tears your eyes produce, how well your tears stay on your eye surface, and whether there is inflammation or damage. By doing this, they can tell if your dry eye is caused by not enough tears, tears evaporating too quickly, or other issues like inflammation. Knowing the exact cause helps doctors choose the best treatment for you. The first step is usually a detailed exam and a conversation about your symptoms and health history. This helps the doctor understand your situation better. One common test is the Schirmer tear test. It involves placing a tiny strip of filter paper under your lower eyelid for about 5 minutes. The amount of wetting on the paper shows how much tear fluid your eyes are making. If the strip gets wet very little, it suggests your eyes aren't producing enough tears. Sometimes, the test is done with anesthesia to see if reflex tears are involved. While useful, it can be a little uncomfortable and sometimes gives inconsistent results. Another quick and simple test is the phenol red thread test. Here, a small thread treated with a pH-sensitive dye is placed on your lower eyelid for just 15 seconds. The length of the color change indicates tear volume. It's less irritating than the Schirmer test and can be done quickly in the clinic. To check tear film stability, doctors often measure tear breakup time or TBUT. They put a tiny amount of dye in your eye and see how long it takes for the tears to break apart or evaporate. Shorter times mean the tear film isn't stable, which can cause dry eye symptoms. Some clinics also use non-invasive methods called non-invasive keratograph (TBUT), which don't require dye and are more comfortable. Doctors also look for damage or dryness on the surface of your eye, using special dyes like fluorescein, rose bengal, or lissamine green. These dyes highlight areas where the cells are damaged or missing, giving clues about the severity of dry eye and surface health. Measuring tear osmolarity is another important test. It checks how concentrated your tears are. Higher osmolarity means your tears are more salty, which indicates tear film instability and dry. This test helps confirm if your dry eye is related to tear evaporation or water deficiency. In some cases, doctors analyze tears for inflammatory markers like matrix metalloproteinase 9. Elevated levels suggest inflammation, which is common in certain types of dry eye. They may also test for tear proteins like lactoferrin, which can reveal how well your lacrimal glands are working. Low levels might point to conditions like Sjogren's syndrome, an autoimmune disease that reduces tear production. Imaging tests called Meibography examine the oil-producing glands in your eyelids. These glands are crucial for preventing tear evaporation. If they are damaged or blocked, it can cause evaporative dry eye. Measuring the thickness of the tear film's oily layer also helps determine if tear evaporation is a major factor. Finally, if your doctor suspects an autoimmune cause like Sjogren's syndrome, they may order blood tests. These look for specific antibodies such as anti-SSA or anti-SSB, which are common in autoimmune diseases affecting tear and saliva glands. In summary, diagnosing your type of dry eye involves a combination of tests that evaluate tear production, tear stability, surface damage, and inflammation. Each test provides a piece of the puzzle, helping your eye care professional create a personalized treatment plan. If you experience persistent dry eye symptoms, it's important to see a specialist who can perform these tests and guide you toward the best care. Always consult with a healthcare professional for proper diagnosis and management tailored to your needs.